Hi, my name is Allison. I'm a nurse injector here at Medical Aesthetics and Laser, and today we're going to be talking about injectables, specifically Botox and fillers. So for injectables, we offer Botox Cosmetic. And for dermal fillers, we offer the full collection of Juvederm fillers, and we also offer Radius. Dermal fillers are used to create and give back volume that we've lost over time. The most common filler that we use here, dermal filler, is a kind of a makeup of hyaluronic acid, which is what we have normally in our body. And as we age, we start to lose that. So we are putting that back in. And the areas that we typically treat with that are cheeks or mid-face, nasolabial folds. Lips are a big area that we do, and now we're super excited because it has been FDA approved to enhance the chin now. The most common areas that Botox is injected are between the brow for those 11s, forehead lines, and around the eyes for crow's feet, as people see it. And typically you will have those injections done every 3 months. So the benefits, it helps decrease the wrinkles, it gives back volume, and just overall it makes women and men feel more confident in the way that they look, whether they're trying to start a new position at work, or just the general aging process does bother a lot of people. And so being able to do these injections, it just gives people a lot more self-confidence in themselves. So if you're interested in Botox and fillers, you've never done any of that before, we would recommend coming in for a complimentary consultation. We'll sit down, we'll talk about everything in depth, make sure all your questions are answered, lay out a plan with you, and then once you've decided you want to proceed, we'll get you back in here and get you taken care of.